Our final panelist this morning is Courtney Howard. Courtney is an emergency physician from Yellowknife. She's the Vice President of the Canadian Association of Physicians for the Environment. She has been instrumental in organizing and pushing the Canadian government, which, as you all know, has changed significantly in the last 2 years. But she's been one of the catalysts, and she's going to describe to us much of the work that she's been able to do in terms of making a very large institution change. Courtney.
So I knew it was going to be tough going after Marshall Gans, and I also knew it was going to be tough going after Ariel. But in a way, it's really appropriate because I was actually inspired to become involved with this by the story of Ariel's community. I was sitting beside, this is the Mackenzie River downstream from where Ariel lives. I was preparing to go on a trip with MSF by working in the north, and I happened to pick up a book on the tar sands in the Edmonton airport, totally naive to environmental problems, and I was reading it while I was in the Mackenzie Delta, and wow, all of a sudden there was a whole new problem at my feet. I didn't know that climate change was a thing. I'd totally forgotten about it during my medical school training. And, I was like, oh, maybe someone solved that during my 12 years in a steady care. Apparently not. And, the tar sands were a problem. And so this part of the world is actually 3 degrees Celsius warmer than it was before. As Robin said, it has consequences for food security, cultural security, and transport, as well as mental health. And so basically, I went from there to Djibouti, where I spent 6 months resuscitating malnourished children. And that was where it really solidified for me. If you get fluids and antibiotics into a person who is tenuously stable, you can save them. If you're even a couple minutes or half an hour late and you do the same thing, it doesn't work and they die. And every clinician has had that experience at the bedside. And my read of the planet right now is that we are tenuously stable and we need to act right now to try to stabilize the system. If we are later, it won't work. And so I came back from that thinking, this is a big problem. And I thought, well, I'll just explain this to a lot of people and that's going to work really well. Well, yeah. People still came to my dinner parties, but that's only because I'm really good at making cake. So we've learned a lot about stories and evidence, and this is a hard truth for us. We've been taught that evidence is the way to go, and it's just not. So I managed to end up on the board of CAPE by sheer enthusiasm, not skill, and I came to the first board meeting and I said, I think we need to work on climate change. They were working on pesticides. And Gideon said, well, what's your target? I said, we need to save the planet together. And he said, you need a target. I was like, what? So I didn't know that had anything to do with anything. And now I do believe that this is actually the way change is made. You need a target. You need to win your target. And that helps you build the team. And all of that is done with stories. So I wanted to check this theory of change with someone who's actually been part of a super important nerdy movement. And this is Dr. Mary Wynne Ashford, who is the international president of the International Physicians for the Prevention of Nuclear War, which won the Nobel Peace Prize in 1985. And she confirmed, she said, we had a whole series of wins, and the more we succeeded, the bigger we got, and the more impact we made. So this means we need to learn new skill sets, and we're not going to get it right the first time, right? The home team is important. Please do give your first presentation at your home hospital or institution. That way, when you go out into the world, people aren't going to be surprised and they'll support you. You don't want to be a lonely advocate. This also means taking care of your home and your family. If you can take off a hat as you add this hat, things will go better for you. This means taking care of the little bit of nature you walk around in every day. Okay, it needs to be walked, it needs to be fed, it needs to be watered, or you're going to get sick and we need you. Okay, whoops, that was the wrong way. Okay, consider the mental health of your audience's team and staff. We have all been here. I have been in this position. Okay, reading Bill McKibben's article when I had a 6-month-old. I was around my 6-month-old. Okay, people who haven't encountered this information, it has huge impact on their psyches, and you need to keep that in mind. I used to do about a 90% problem, 10% solution presentation. I gradually ratcheted that back to about 30-70, and I was talking to Nick one day, and he said he had 2. And so really, this is what we need to do. We need to help people envision where we're going to so that they can start to slot themselves into that picture. Or you can just put funny slides in your presentation. That works too. I encourage that. Okay? So persistence has been getting some airtime lately, which is good. The change at the Canadian Medical Association, my initial totally naive motion was actually for the Canadian Medical Association to support increased peer-reviewed studies into the health impacts of the oil sands. And I thought to myself, who could argue with that? Doctors love evidence. Well, it turns out they could. And we had a big fight. And the good thing about a fight, conflict, it turns out, generates media coverage. We made newspaper headlines across the country, so there's a lesson. I was shell-shocked, but whatever. We came back the next year, had a bunch of climate health motions, did not pass. The year after that, we actually really kind of got funky. We had a paper mache globe. I brought my baby. I advise you to bring your baby when you're doing things, also puppies. We talked to everybody, and the motions actually passed. The most important thing we did was at this point we were getting them to take a look at divestment because the BMA had already voted to divest at this point, the British Medical Association, and we wanted to replicate that. And so I sat down with some of the vice presidents of MD Financial, who are the financial arm of the Canadian Medical Association, and they and explained to them about the carbon bubble. And at that point, they were naive to the concept. It was a few years ago. It wasn't talked about as much. Put them on the Carbon Tracker website. They were just like, is this legit? Is this legit? I said, yeah. This is legit. Do you see the logo where it says London School of Economics? Do you think those guys are legit? And we're like, mm-hmm. And so then about 2 minutes later, we were talking to the president of MD Financial. And from that point forward, we were crafting motions in association with them that they would be able to make action with, that actually made sense. And basically the next year, we had the motions ready with them. We voted to divest. It was close, but it passed. We voted for the CMA to also promote the health impacts of carbon pricing. Because I basically got up and read the Lancet quote, so thank you to everyone who contributed to that from the 2015 Commission. And they were like, okay, sure. By then, they were like, just do it. And the next year, James Urbinski, who's in the crowd here, came and gave our keynote on climate change and health. They confirmed that they had divested because they'd made a fossil-free fund, and they had transferred the CMA's money into that fund, and now that fund is available for other physicians to invest in. And thank you. And what was the coolest thing was that they're proud of it. Okay, this is the head of MD Financial, Brian Peters. This is the VP, Alison Seymour. They are proud of it. Like, this enabled them to give meaning to their work. So sometimes I feel like we're making an ask and we feel scared to do that, but it's an offering also. Everybody wants to help with this, and if you can help other people figure out how to do that within their realm of achievement, that's an offering. We've done a lot of work with CAPE on coal phase-out, and I think this is a really good target for you in the U.S. You can do it locally. This is all done based on asthma. So we've done this with big health coalitions. In Ontario, we managed to actually phase out all of the coal power. So that's a 30 megaton savings, which is the largest single greenhouse gas reduction maneuver in North America. We transferred that same plan to Alberta and ended up getting a commitment to coal phase out in Alberta. Alberta is the province that Ariel lives in. This is the most right-wing province in Canada. But when you talk about asthma and you have imagery of kids with puffers and you have stats associated with the morbidity and mortality, that's what changes opinions. Who tells the story? We've asked this a lot. Opinion surveys say that people trust doctors, scientists, and nurses actually topped this last year more than anyone else. So I say we try to do that. And so give everybody media training. Every single person, give them media training. See who's good at it. If they're not good, stop. Right? So aspects of this are make you feel silly. Okay, I felt super silly getting these photos taken. This was for a article in the Canadian Family Physician. James Urbinski was there, and he actually said, I said, James, I feel really silly getting my photo taken. And he said, Courtney, it's part of the job. And then I laughed, and that's when they took this picture. Offer kudos to colleagues. This is Katie Gibbs. She started Evidence for Democracy in Canada. She started it with this brilliant protest. It was the death of evidence. They carried a coffin to Parliament Hill. All the scientists were wearing their lab coats. Costumes, story, drama. Look at this. She followed this up by founding an organization that she currently heads. She went from being a PhD to being the executive director of this, and she's pushed this through. There's actually now a science parliamentary monitor person that they've created more or less because of a result of this advocacy. When you're picking your own target, sometimes it's easy to join people who are already doing things. There's a divestment campaign at every single university pretty much in this country, and many of them are not yet benefiting from having the voice of health at their side. Go find them. They're going to teach you so many advocacy skills you didn't even know about. Again, multidisciplinary teams are key. How do you find these people? I was lucky to go to the Social Change Institute, which is where I met Ariel. And there are people here with jobs I didn't even know. They analyze social media, figure out who opens things, like look at photos online, which ones do people click on. We need to figure this stuff out. We need, between ourselves, to find an online way of better connecting. I don't care what platform it is, but we need to find one, and we need to all be on the same one so we can access ourselves. I believe that lack of cool people is still our biggest problem. So to access cool people, we either need to make new friends, which, is good, or we need money. I think this is probably faster, but we need some of that. We managed to, under our new executive director, Kim Parada, transfer this countrywide. So we decided to go for Canadian coal phase out. Joe Vipon was really the mastermind behind this. We recruited doctor advocates from all of the different provinces, and 9 months later, with the help of a whole bunch of behind-the-scenes environmental NGOs. We knew all of the NGOs in each community who are most key to this. We had monthly teleconferences where we talked about who knew what, and the minister said this, and we heard the announcements coming then. Coordinated op-eds so we weren't in competition with one another, and about 9 months later, with the opportunity of a government that listens to evidence and is looking for social license to make the climate maneuvers that they believe need to happen, managed to win this. And this is Joe Vipon, who's really spearheaded a lot of this. Now we're working on fracking in BC. We have a physician community in BC who's looking at fracking. We need to interact with resource extraction. I haven't heard a lot about resource extraction, but if we need to leave 90% or 80% of fossil fuels in the ground, especially when there's toxic effects on vulnerable communities in British Columbia, it's Aboriginal people in the northeastern part of the province. Physicians are starting to work on that. We need to figure out what images are best. Do we do Facebook message testing? How do we get the data on the audiences we need to target to be most effective? These are the things we need to figure out. We need to learn how to be better allies to our Aboriginal people, and if they're in a place like Standing Rock, we need to go stand beside them. Témoignage is a feature of the MSF movement that I believe is really important, and basically it's about speaking truth to power in the pursuit of justice. Since I worked with MSF, this has been something I've carried through with me into my environmental work, and I think that this is important because we're going to be in contact with a lot of vulnerable communities, and I think that we owe it to them. Bottom line, what story are we telling ourselves? So are we saying if we don't transition quickly to a sustainable way of life, humanity is doomed? Or are we saying we are transitioning to a more sustainable and resilient way of life that will offer tremendous benefits to humanity? I wasn't a great competitive gymnast, but I had Olympic level coaching, and I know which message they would have told me to put in my head before I went into competition. So bottom line, it's about building the team, which is what we're doing here and what we're starting. It's about learning to set targets, which have been identified in a lot of the research, and it's about winning and telling stories. And I just want to thank you because I've been so inspired by you this weekend, and I look forward to all the work we're going to do together.
Courtney, that is a terrific and what a wonderful panel. We're running a little bit late. Gina McCarthy is here and has agreed that if we slip a little, about 10 more minutes, that would be all right with her. I want to just underscore one final point. This is not easy work. This is very, very hard work. It is persistent, persistent, persistent. I would remind us that right here in our own backyard, Harvard University refuses to look at a policy on investments that has to reference divesting. They refuse to do so. Bragging about the research they're doing, the training that they're doing, how the facilities at Harvard are becoming more climate resistant and so on, but refusing to make consistent their investment policy with what else happens in the university. It's remarkable. Of all the places in the world, that is an indication, it seems to me, of how hard this is, how much work we have to do, but also it's a great target, and we're going to knock that down. Anyway,